Welcome back. Uganda recorded 126 new infections last night with a 7-day average of 64 cases. The country's total cases between February the 1st and 14th reached almost 1,000 cases. Well, to talk more about tackling the pandemic there, Dr. Monica Musenero Masanza, Minister in charge of Science, Technology, Innovation with the Office of the President, Uganda, joins us now for more. Thank you, Doctor, for joining us on the program.
Thank you very much for having me.
All right. Doctor, give us an idea of how Uganda has survived the coronavirus pandemic.
Uganda has done quite well. We thought we would be doing very, very badly up to this point. We got our first case in March 2020 on the 21st. We went for scientifically designed measures. So we started by, we were a country that locked down before we got our first case. The rationale was that we were not prepared. We didn't have tools to help us fight, even if we had only one case. During that time, we put in place measures to help us, first going for basic tools, making sure we have hand sanitizers, we have proper information about whether masks help, and generally get the scientific information. So when you look at our first wave, which was started around March 2021, which was largely imported cases, we did not have community transmission because we restricted those imported cases because the country was not ready to mount a response, and also buying time to learn from areas where they were having a lot of cases. So during that time, we applied a lot of classic epidemiology. Most of the cases that arose were healthy people who are traveling, so we didn't have even a single death. Of course, later, we went into now the second wave that we call our second wave. And that is when we had some, we had the deaths, we had some deaths. We had, after some time and the monitoring, strictly epidemiologically monitoring our capacity, which we had built in the hospitals, we were able to waive that with very few deaths. At that time, we had less than 300 deaths in that second wave. We try to balance the hospital, the available hospital capacity with the restrictions. So when we put restrictions, we had to try and manage them. Of course, when that wave went down, we tried to open up. We tried to open up the economy because you're trying to balance the economy with the public health. But also then we were trying to build the capacity, a capacity for treatment, opening up more treatment space, capacity for prevention. And as that took us into the second year. And as you know, by 2021, early 2021, vaccines had started appearing on the horizon. So we tried to access vaccines as quickly as possible to try and protect especially our elderly population, who were the ones who were getting very affected and dying. Access to vaccines was slow, and it also came along with a lot of anti-vaxxer messages from all over the world. However, we started some vaccination early 2021. Just like every country, we've struggled with uptake, but we have moved. We have done a lot of aggressive campaigns and communication and going to where people are. And then we had our third wave. Now, that is the Delta. Now, Delta hit us most. Our deaths rose from 10 times. Our hospital capacity almost came to being overwhelmed. Again, we had to now bring a lockdown to try and curb that, to reduce that. Now, Uganda
I want
has
to
a lot
quickly
of
ask,
young people. And,
Doctor, I want to quickly ask you,
yes.
because I know that you've been, previously played leading roles in the control of Ebola, also several other epidemics in the DRC, Sierra Leone. When you think of how Africa has fought COVID, what would you say the future holds for us in fighting epidemics or pandemics like COVID-19? Briefly, if you can.
Yes, Africa should be the champion. We should, the rest of the world should be learning from us, because we have been battered by these epidemics and we have a lot of capacity on the continent. It's just that sometimes when the real situation comes, we do not deploy it. So COVID is massively has not damaged Africa the way it had been explained. But one of the things we should take from here is this is one thing Africa can share with the world. We are the ones who really know what to do with the pandemics and epidemics. And we need to get out of that corner and begin sharing this capacity, sharing this competence with the world. Secondly, Africa, we need to make sure that we are no longer dependent on tools. We needed to pick courage and start working on tools, because we are at the epicenter. This one came from out, but likely immediately this one goes down, one is going to rise from our midst. So we needed to learn, and especially in my field of science, technology, and innovation, we must make sure that Africa builds capacity, one, to make vaccines. We should be able to do research and develop vaccines. It's not very difficult. Uganda has started. We have vaccine candidates that we have, some of them have almost finished animal trials. We should be courageous. Two, we need to build the other tools. All these things that you have to go somewhere to give you PPE, to give you basic things. And Africa also needs to learn that beyond public health, epidemics are an economic tool. If you look at what was in West Africa, Ebola, there was a lot of money. So we needed to not just look at it as when you have an epidemic, you have charity, you have the world come and donate to you. We also need to look at epidemics as something that we can build industries and create jobs and also contribute to the world.
A lot to think about. We appreciate your time. Thank you so much, Dr. Monica Musenera Masanza, Minister in charge of Science Technology, Office of the President of Uganda. Thank you for joining us on the program.
Thank you for having me. Greetings to Nigerians.
Thank you.